And now, past president Jackie Hurd Barber is going to introduce our speaker. Jackie?
Thank you, Past President Kathy. MCW is proud to be increasing its efforts as a partner to local, state, and national efforts on the issue of gun violence prevention through our comprehensive injury center led by Dr. Terry Darun Cassini and their dynamic team, including Reggie Moore. Although MCW is widely known as a premier institution for preparing the next generation of healthcare practitioners, many of our faculty provide frontline care at the region's only level 1 trauma centers for children and adults, Frederick and Children's of Wisconsin. They see the tragic consequences of the unspeakable harm that gun violence causes to the human body on a regular basis. Last year, over 500 gunshot survivors were treated at Frederick Hospital's Level 1 trauma, and a historic number of children were treated for gunshot injuries at Children's. The issue is deeply personal to so many in leadership and staff at MCW and across our medical campus. And I say our because I'm secretary of the board of MCW. The timing of this presentation is critical, not simply due to the rash of mass shootings across the country or our own mass shooting early this summer in the downtown area, but because this is a public health crisis that has gone under-resourced and under-addressed for far too long, while most vulnerable members of our society have suffered unimaginable levels of injury and death resulting from firearm violence in Milwaukee and communities throughout the country on a daily basis. We all have a role to play to advance safety and well-being in this city, and by the end of today's presentation, I hope that you determine yours. As a proud and immediate past board chair of the Greater Milwaukee Foundation, I want to acknowledge its recent investment of $1 million to support violence prevention efforts in the city of Milwaukee. The investment came as a result of board and staff looking inward to determine its role and responsibilities to support community-driven efforts to address this issue in coordination with the city's Office of Violence Prevention, led by Anita Holloman. We have invited others to join us in matching this investment. Reggie Moore, I've known him for over 20 years, serves as the Director of Violence Prevention, Policy, and Engagement for the Comprehensive Injury Center at the Medical College of Wisconsin. Prior to this date, Reggie served as the Injury and Violence Prevention Director for the City of Milwaukee Health Department's Office of Violence Prevention, also known as OVP. In 2017, OVP facilitated the development and launch of Milwaukee's first comprehensive violence prevention plan known as the Blueprint for Peace, which he presented at Rotary a few years back. The Blueprint is a community-driven plan that takes a public health approach to addressing the root causes of violence and trauma in Milwaukee. Reggie has led local and national efforts at the Center for Youth Engagement, Public Allies, Urban Underground, Movement Strategy Center in Oakland, California, and the Truth Initiative in Washington, D.C. He has provided training and support for youth engagement efforts in the United States, United Kingdom, and Canada. He has also volunteered his time with several local and national organizations, including the National Funders Collaborative on Youth Organizing, Coalition for Justice, Milwaukee Succeeds, Youth Justice Milwaukee, Beyond the Bell Milwaukee, True School, and the Prevention Institute. In 2019, he was selected for the National Policy Link Ambassadors for Health Equity Fellowship Program and is a 2022 graduate of the National Annie E. Casey Equity for Results Fellowship Program. An organizer to his core, Reggie has dedicated his life to public service as a strategic organizer and advocate for vulnerable youth, families, and communities. Please join me in welcoming Reggie.
right, good afternoon. You all run a tight ship here with the bills, and so I want to make sure I stay on schedule. First of all, thank you so much for that kind and generous introduction. Thank you all for being here. And I'm going to ask that we actually give a round of applause for the investment that the Greater Milwaukee Foundation made, because I think that's significant. So I only have 100 slides to get through, so I'm going to try to move quickly. Um, and these will also be available. So again, if there's something that you want to kind of dive deeper into, I'll also leave my contact information. Always happy to talk. With that being said, so I direct the Division of Violence Prevention at the Comprehensive Injury Center under the leadership of Dr. Terry DeRone Cassini. And the center was actually started by Dr. Steve Hartgarden back in 1998. And he's nationally known for his gun violence prevention research. And under Terry's leadership, we have also expanded significantly, where we also house the Alcohol Policy Project. We have a growing division on suicide prevention, and I lead the Division of Violence Prevention. And so a lot of our work is focused at the state and national level, but we also have a significant amount of investment and partnership locally, primarily with the Forum for Life program. And joining me today is Natalie Montez, as well as Steve Hopkins. If we can give them a round of applause. Natalie is a part of the outreach team, and Steve is the outreach supervisor for Forum for Life, and he's been a part of the program from the beginning. So in terms of our state work, a lot of our work really is around how do we take the movement that has started in Milwaukee and how do we expand that statewide? And I know since 2020, there's been a lot of concern, a lot of frustration, and a lot of worry about where we are as a city as it relates to gun violence. I don't know if fortunately or unfortunately, I would say unfortunately, we're not alone. And so this is an issue that many cities across the country are grappling with, and really understanding that from 2016 to 2019, we saw a steady 4-year decline in homicides in this city. And we credit that to the movement of really looking at violence as a public health issue, where thousands of residents were involved not only in informing the blueprint, but actually implementing it and actualizing it, partnering with organizations like the Greater Milwaukee Foundation, Fragrant Hospital, many community groups, really saying, how do we all play a role in making this city safer? And understanding that safety is not just the absence of harm and violence, but actually the presence of opportunity, the presence and access to resources, to quality housing, to affordable to affordable homes, as well as family sustaining employment. So these are the things when we talk about violence prevention, that's what it means. It's not anti-enforcement. It should not be an either or proposition. But the best police chiefs in the country will tell you, and the best DAs in the country, I see Assistant DA Ken Levering here as well, that the criminal justice system cannot take on this issue alone. We have to have a comprehensive approach, and we all have a role to play in that, whether you represent philanthropy, the business community, healthcare, youth organizations, etc. So at the state level, we have partnered with the governor's office and state government to basically implement a statewide violence prevention fund. So he has seeded that fund with $10 million of ARPA funding that will be available to communities throughout the state. He gave a direct allocation of $8.4 million to the city of Milwaukee. So the fund will be accessible to communities outside of the city of Milwaukee because Milwaukee got a direct allocation. And the Office of Violence Prevention has a $16.8 million ARPA request that they have requested of both the city, and before Mayor Barrett left, there was a 3.1 allocation made to that end. And so the hope is that, and Chevy has made, President Johnson has made a commitment to adding to that to complete that match. But at the end of the day, understanding that ARPA is only temporary funding, we have to have a vision beyond emergency funding for this issue. So the way that we guarantee prisons, the way that we guarantee enforcement, the way that we guarantee that somebody has a hospital bed if they are shot, we have to guarantee that there's investment in prevention. That every young person in the city has access to a quality, caring, and consistent adult, whether that's in their home or in an after-school program, a sports league. When you think about the Boys and Girls Club and Running Rebels and organizations like that, those are the things that we have to invest in. And this is, again, a movement that we're taking throughout the state. At the national level, we also are working with cities throughout the country who are looking to implement or develop their own blueprints for peace. as well as either launch or develop either offices of neighborhood safety or offices of violence prevention. And the reason why that's important is there has to be a central entity in whatever level or branch of government that it is that is focused on and accountable for prevention, not accountable for crime, accountable for prevention. And what that means is ensuring that the investments are going, and well, number one, that the investments exist and that the investments are going where they are needed to the populations and the communities that are heavily impacted by violence. And so these are some of the cities that we're working with nationally in partnership with an organization called CF Leads, which President Gilligan of the Greater Milwaukee Foundation, I believe, was the past president of. And so we've been able to support other community foundations around the country who are also looking to take on this issue. And they've been meeting for over a year, and their last meeting is actually going to be in Milwaukee in August. So really proud that GMF will be hosting that. These are some of the national partners that we work with. And I am happy to jump to this slide. So this time yesterday, myself, Dr. Terry Jerome Cassini, along with Director Holloman, who leads the Office of Violence Prevention for the city, along with 2,000 advocates from around the country, as well as survivors, were invited to the White House yesterday to commemorate the signing of the Bipartisan Safer Communities Act. And this is an unprecedented advancement around gun violence prevention policy in the country. And so, as we know, the headline that led about the event by the media was around Mr. Oliver, who I've had the pleasure of meeting, who's a Parkland dad whose son was killed. And he stood up at the event and he challenged the president to say this isn't enough. And I agree with him. I think the president agrees with him. I think most Americans agree with him. And as a father myself, this issue is deeply personal. As a African-American man who was born and raised in this city and the son of this city, I have been directly impacted by gun violence as a young person. I've lost friends to gun violence. And in my work with young people in this community, I see the impact that it has on the lives, not just of young people, but adults, families, teachers, everyone who cares about what happens in this city. And so this is just a quick snapshot of why I care about this city, why I care about what happens in it. As a father of twin boys who just graduated from Rufus King High School, and a daughter who is a rising junior at Rufus King High School, and all of the young people and all of the organizations and individuals like you in this city that I have an honor of meeting, of knowing, of working with, we all have a responsibility to make this city safe and strong for everybody. So what I'm gonna try to cover today in a very brief period of time is, number one, understanding safety. And the fact that, again, safety is not just the absence of violence, it's also the presence of peace and opportunity. I will touch on how we got here, talk a little bit about perception versus reality. That's a really cool term for data. So I will talk a lot about what's happening at the national level, at the state level, and at the local level. And then also talk about the importance of really advancing solutions and not putting politics over peace. So when we talk about violence, the World Health Organization identifies or defines violence as the intentional use of physical force or power threatened actual against oneself or another person or group or community. So it is beyond just gun violence. It is beyond just a fight or harm that's done physically. It is also deprivation. It is also inflicted by policy. It is also inflicted by neglect. And it is also inflicted and has been inflicted historically. All of those things play a role in the conditions for violence to occur. And so when you travel to cities throughout the country and you see areas, or you look at the census data and you overlay the data around concentrated poverty or concentrated unemployment, and you overlay that with the data around gun violence, often you see a direct overlap. And so you cannot separate the conditions from the actual impact that's happening in terms of what we see show up in hospital rooms and courtrooms and everywhere else in the city. So when we think about violence and the impact that it has, again, we often just think about the physical impact. And so what happens in terms of to the body. But it also impacts disease outcomes. It has impact on risky behaviors, whether that's tobacco misuse or alcoholism, drug use. Also, in terms of child and maternal health and the stress and tension all of that causes, as well as mental health. And oftentimes we convolute mental health and we blame and we say everything is mental health when it comes to gun violence. And it stigmatizes people who may be struggling with mental health issues, and everyone, by and large, who has mental health issues are not violent. But we also understand that there are people who do struggle with depression or PTSD that may lead to either self-harm or harming others. And so again, not saying mental health isn't a factor at all, but we have to be careful, sensitive, and smart about not oversimplifying this issue. It is also important to understand that this is a uniquely American problem. And so when you think about where the United States stands in comparison to other countries around, particularly high income countries around the world, again, the United States stands out significantly as it relates to gun violence. Firearms have become the leading cause of death for American children and teens as of 2020. And I want that to sink in for a minute. Exceeding cancer, which we hear a lot about, a lot of money is raised around cancer research. A lot of effort rightfully is poured into addressing and preventing that. When you think about motor vehicle accidents, poisoning, and so when you think about the movement that has happened in this country and the amount of mass shootings and the daily violence that we see on the streets, not only of Milwaukee, but again, cities around the country, young people have been leading the charge. And they have been demanding change, whether that's March for Our Lives, whether that's Students Against Gun Violence, the Children's Defense Fund. Many organizations locally and nationally have been calling for adults, us in this room, and their peers to do more around preventing gun violence. I want to shout out, and I invited Dr. Megan Schultz, if you can raise your hand. She wrote a very powerful and profound opinion piece that was published in the Journal Sentinel, I believe, last week. And she is an ER doc at Children's Hospital, and she sees the impact physically, emotionally, and psychologically, not only on the children that she works to save, but also on their parents. And the title of her opinion piece is What Keeps an ER Doctor Up at Night? The Sound a Mother Makes After Her Child Dies. When I started as the director of the City of Milwaukee Office of, actually I was still contemplating taking on the role or the appointment to take on that office. I reached out to others around the country, which there were very few. Now there are over 30 offices of violence prevention in cities across the country. And I remember Sasha Cotton, who leads the office in Minneapolis, and she's served under 3 mayors now. And so they have an ongoing and consistent commitment to violence prevention. And she says, Reggie, although this isn't your responsibility and there's nothing you could do to have stopped it, you need to prepare yourself for your first child funeral. Because you and the mayor will go and you will comfort the family and you will look them in the eye. And at the end of the year, God forbid, but often we can predict, there will likely be at least a dozen children who have died while you are serving in that office, just that year alone. And you may have made it to half of the funerals, if not all of them. But the first one you won't forget. And Zalea Jenkins was my first. And she was 9 years old. And she was shot by an assault rifle between people in a shootout outside of her home on 9th and Meineke. And I haven't forgotten her. And in the Blueprint for Peace, which I brought a couple of copies for folks to take, we dedicated the blueprint to the children whose lives were lost while we were actually working on planning. Because we weren't just working on planning, because while the blueprint was being developed, the Sherman Park Unrest happened. While the blueprint was being developed, over just a year's time, so it wasn't like people were slow walking or taking their time, 17 children were killed in the city during that year course of time. And so this is something that should be deeply personal to all of us. And I know this is a very sobering message, but the pain that families and young people in this city feel should be even more sobering. And if anything that I say or anything that you see in this presentation makes you uncomfortable, it should. And it should make you uncomfortable enough to do something about it. Because this should be unacceptable to all of us, as it is unacceptable to the ER doctors, to the EMTs, to law enforcement, to everybody, to Forward for Life, who are trying to mediate conflicts before they end in gun violence or stop retaliation. It should be uncomfortable for all of us. So how do we get here? Fear, inaction, obstruction, indifference. So I'm going to cover really quick in these. Is that 6 minutes? I just want to make sure. Okay. Cool. Oh, 15. Good. Okay. I was about to say, whoa, talk fast. So in terms of the violent crime rate, now, if I told you before pulling up this slide, do you believe that the world or United States is safer now than it was in 1990? You probably would say absolutely not. And so when you think about kind of where we are in violent crime from 1979 to 2020, that overall as a country, the violent crime rate, and I want to be clear, the rate is lower than it has been, at least since that period of time. And so when we think about the perception versus the reality of violence, it didn't matter that we had a steady 4-year decline of homicides in the city. And most people didn't even know that. But if I asked my brother or my mother or my neighbor if they felt safer in the city during that time, they likely would have said no. And that is a primal challenge in public health and understanding how data obviously tells a story, but it doesn't tell the complete story. And that safety for some is a feeling. If I don't feel safe, then I must not be safe. And some people are safe in environments that other people may not feel safe in. But at the end of the day, everything that we do in public health is driven by data. And so when we think about gun deaths over time through 2021, the increase is clear as we think about the amount of folks that we have lost or the amount of homicides that have occurred due to gun violence and the increase that we saw after the start of the pandemic. Another thing that I want to underscore with this data is the fact that oftentimes, and again, this plays into the perception issue, is that when we think about who a trigger puller is, we often think of a young person, and particularly a teenager, and a teenager of color. And what's important to note is that most shooters are not teenagers. And so, do we have a car theft problem? Do we have a reckless driving problem? Although I've seen people my grandmother's age driving recklessly. Yes, we do have those issues. But in terms of who's actually pulling the trigger, is not teenagers. Before the pandemic, the average age of a shooter in the city was 29 years old. It's a young adult problem, but it's an adult problem. And so, even when you think about the shooting that happened on Water Street, some of those young men are young men that Steve worked with when they were in high school. And a major fight happened in their high school. And there was threats to shoot up the high school, which is in the central city of Milwaukee. The team mediated that conflict, and the principal invited them to come into that school, and all of the young men graduated. And I recently presented to the Greater Milwaukee Foundation Board, and I brought up this point because I know that Milwaukee Succeeds and a lot of the amazing work that's done. There's a population called Opportunity Youth. And it's basically 18 to 24-year-olds in this city who are locked out, pushed out, or kept out of opportunities to be connected, whether it's to employment, education, or other support services. And so we may do a lot at early childhood. We may have after-school programs and athletic programs for, primary school grades. But once young people become 18, as a society, we kind of write them off. And we know that brain development doesn't stop until 25. And most young people who are lucky enough to go to college are in an environment where they take wild risks in a very structured environment, right? And they join organizations called fraternities and sororities if they so choose, and they take additional risks that may not result in death, injury, or incarceration. But imagine the thousands of young men and young women in this country who do not have or cannot take advantage of those opportunities. What are we doing for them? And so when we think about making sure that we're not being, number one, that we're being driven by data, that we understand what's happening, where it's happening, who it's happening to, that it informs our investments and our approaches. The other thing that I want to note, again, to try to clarify the perception versus reality, is the fact that most harm occurs between people who know each other. And regardless of your race, age, etc., there's some connection. Whether you're an associate, a friend, a neighbor, a coworker, most violence occurs between people who know each other. The mayor of Highland Park, Illinois, was the Cub Scout leader, I think it was Cub Scouts, of the young man who shot up the parade. His father, I guess, had attempted to run for mayor at some point. Everyone in this town knows him. Now, unless you were a visitor to that parade, there was an association or connection between that mass shooter and that crowd. I won't go into detail on each of these points, but they're pretty self-explanatory. But number one, understanding intimate partner homicides. Again, the fact that gun violence is now the leading cause of death for children and teens. But also, if you're a fiscal or financial person, maybe the economic cost will move you. Gun violence costs Wisconsin $3.9 billion each year, of which $138.6 million is paid by taxpayers. For context, the city of Milwaukee's Office of Violence Prevention budget is $2.3 million of tax levy dollars. The rest of that money that it has is raised through federal competitive grants. And so when we talk about the return on investment on prevention, it's extremely clear and extremely important. And so when we think about, now I'm going to kind of drill down to Wisconsin and then local. So in the United States versus Wisconsin, the rate of gun deaths obviously increased. Again, this is facts that we all know, but again, just trying to show in hard numbers and data what that looks like. And then also in terms of the counties in Wisconsin that bear a significant burden of firearm-related injuries, obviously Milwaukee County, followed by Racine, Kenosha, Rockdale, Fond du Lac, and so on. And so this is data that will inform our statewide work and investments outside of Milwaukee, while we continue to also support the work that's happening in Milwaukee. So now coming down to local trends. So when you look at 2018 to 2020, and the sharp increase that was seen in terms of homicide, the homicide rate, there was a significant increase. And so in terms of the monthly homicide rate, there's something at Freighter in the medical college that we talk about in terms of trauma season, where we know that during the warmer months, there's an increase or sharp increase in the amount of injuries that we see, whether it's from violence, car accidents, motorcycle accidents, etc. Unfortunately, that trauma season now is all year. And gun violence is not slowed in the fall or the summer. And then when we think about other cities, so across 22 cities evaluated by the Council on Criminal Justice, the increase in the homicide rate occurred across multiple cities since the start of the pandemic. So you can kind of see where Milwaukee falls in this data. And again, understanding that our increase, although definitely significant on a local level, in comparison to other cities is not the worst in the country. And then looking at homicide and non-fatal shooting trend data, again, looking at this combined of non-firearm related homicides versus firearm related versus non-fatal shootings and homicides. This data or this kind of trend line, again, affirms the direction that unfortunately Milwaukee is headed in. If you look at the two green lines on this particular chart, the green line on the left is January 2020. Obviously, the shutdown orders went into place March of 2020. And so just understanding where the spike started to happen. And I was still the director of OVP at the time. And so being in the health department, we were essential workers, so we never shut down. I wholeheartedly believe that gun violence will go down during the pandemic. Nobody's outside. At the same time, it skyrocketed. Number one, with the violence that we saw in homes, whether it's family or domestic violence related, but also the level of road rage shootings and the amount of children that were killed in those incidents that year. There was a lot happening that went under the radar. And although there were early reports that child abuse went down during the pandemic, the young people were more vulnerable because they were not in contact with adults like teachers, coaches, and other people who would normally make those reports. And so it's really important to understand that the impact that the pandemic had on different data points that we track, whether it's child abuse, gun violence, domestic violence, etc. This is just for 2020. Is there a neighborhood up there that stands out to you? That seems surprising that it's up there? You don't have to raise your hand, you can just yell it out. Okay, for the sake of time, I'll jump in. Juneau County. Right. So if you've ever been to Bastille Days, that would be the Juneautown area, downtown near the Fiserv Forum, pretty much everything east of it. And so that number is high because of the mass shooting that happened, or the 14-person incident that happened down there. But that is not a priority neighborhood for the Blueprint for Peace, for Forum for Life, nor should it be a priority neighborhood for investment in violence prevention. And this is where I start to kind of blend into the politics of peace. And similar incidents have happened in other cities around the country. In, I believe it was Cleveland, there was a shooting in front of a hotel in downtown Cleveland. And understandably, business interests went after the mayor and other people and said, what are you doing about gun violence in the city? And the frustration with that question is the fact that one incident of gun violence is unacceptable in certain areas of a city, but it seems to be quite acceptable in others. And I think an important opportunity in that question is how can we be concerned about this every day? And what can we do? And what is the role of our business to care about every neighborhood in the city that experiences gunshots, gun violence, injury, and death almost every single day? And some businesses have done that. The Bucks has provided support to 4-1 for Life to support some of our support of gunshot survivors. When you think about, I believe his name is Omar, who runs Carnivore, or owns Carnivore. He started a fund after the young lady was killed at Burger King. He did a fundraiser. And beyond that, he has an interest in creating a compassion fund, very similar to the compassion fund that exists after mass shootings. And the Greater Milwaukee Foundation, that's one of their priorities that they've seeded in their funding, because oftentimes crime victims in urban communities don't have access to the same victim or crime victim funding support that they need. And so there are many important opportunities, even beyond money, that people can get involved and care about what's happening as it relates to gun violence in the city. And so in this particular chart, again, this is just talking about homicides and non-fatal shooting data, looking at, again, the percent of victims ages 18 and under, percent of victims 24 and under, female victims, as well as incidents involving domestic violence or intimate partner violence. So the important work that Sojourner Family Peace Center is doing, among many other organizations, the ASHA Project that are working on family and intimate partner violence. Again, this is still a concerning issue. It may seem low in terms of the percentage, but understand that there's a lot of violence that goes under or unreported as it relates to family and domestic violence. And then the last data point locally is around suicide trend data, and this is pertaining to Milwaukee County. And so this is an area of concern for our center, but also as it relates to how do we ensure that people who are under stress, duress, or other psychological or emotional, or having or experiencing psychological or emotional struggles, have access to the support that they need. So now I'm going to move to solutions. Time check. Awesome. So gun violence prevention policy. So again, being in DC, this is just because people have questions around what did the Safer Communities Act actually mean, or what does it mean? Number one, it enhanced background checks for buyers under 21. It supports state red flag laws. However, now, what this means is that there's funding to incentivize states to pass red flag laws, meaning that law enforcement can temporarily remove firearms from the home of an individual, either reported by a family member or if there's been multiple calls to that residence for a mental health or other crisis, to actually temporarily remove those firearms. However, state legislators still have to pass that law. And so this is an important point of advocacy and knowledge and information to make sure that if this is important to this city, if this is important to the state, that people are paying attention to that. The next one is around disarming domestic abusers. So there was something called the boyfriend loophole, where guns could not be confiscated based on the relationship, the former relationship or informal relationship with the partner. And so unless you were married or living together. And so this addresses that. And then clarify who must run a background check for the sales of firearms, because some private sales were not conducting background checks. And so ensuring that people are very clear about their role and responsibility legally to do that, and also increasing penalties if that does not happen. The other half is looking at gun trafficking, and so ensuring that the ATF and other law enforcement agencies are enforcing the laws on the books and conducting thorough investigations to prevent and reduce gun trafficking, funding community violence prevention and intervention programs, investing in mental health services, particularly for students, but also adults and communities, and then providing increased funding for school safety. So lastly, I'm going to talk about community-based solutions. And so this is from Cities United, and this is an organization that is based out of Louisville, but actually works with mayors and cities around the country. And so they actually used our Blueprint for Peace to inform their sort of framework for safe and healthy communities. And so they also work with cities around the country to take more comprehensive approaches to violence prevention. And so as it relates to interrupting the cycle of violence, these are examples of interventions that they recommend that, again, are research and evidence-based. Street outreach, violence interruption, which again is what Forum for Life does locally. Hospital-based violence interventions, so like Project Ujima, as well as the Forum for Life Hospital Response Program. So every gunshot victim, 18 and older, that arrives at Freighter that fits several other criteria, meaning that there's high risk of either retaliation or re-injury, our hospital responder from Forum for Life actually responds to the hospital to, number one, begin to prevent and, well, number one, de-escalate and try to prevent the likelihood of retaliation, but also provide comfort and support to that family. In terms of systems of inequity, again, looking at access to quality education, expanding healing-centered engagement in neighborhoods, building an inclusive economy. These are some of the structural and systemic factors that are called for, again, that also align with violence prevention. And then lastly, investing in sustainability. So looking at, in terms of tracking the cost of public safety, assessing city and philanthropic investment, adopting a comprehensive evaluation framework. Because again, there's a lot of attention and scrutiny around, do these measures work? And again, I would argue that there seems to be an inequitable standard around what we want to evaluate or measure as it pertains to public safety. At the same time, given that this is rooted in public health, the infrastructure is there. Places like the medical college are willing, and there are efforts around the country to also evaluate and assess and also report out the impact that these programs are having on communities. Milwaukee, again, has been ahead of the country in the curve in reimagining public safety through its development of the Blueprint for Peace that has 6 goals and 30 strategies. And again, understanding the intersection between prevention, intervention, and healing. Investment has to be made across all of these, because when you look at the fact that on an average year, we have about what we've had before the pandemic, 300 non-fatal shootings a year. I know last year we were close to 800. That is a lot of pain and grief walking around this city of our friends, our coworkers, our neighbors. And so healing is extremely important. Although people may say, well, what does healing have to do with prevention? Because there's a lot of pain that if it isn't transformed, is transferred. With some of the young people that Steve and Natalie are working with, we call them pain-based groups because it's not the 80s anymore. It's not hierarchical street gangs that are at war with each other causing the shooting. Many of the shootings are situational, disrespect, road rage, people owing money, drug-related. It's very situational. It's not group-based as much. However, there are groups of young people in the city. You may hear about the Kia Boys. That's really connected to a brand of a car, and young people who kind of loosely affiliate with that identity, because again, young people are looking for something to belong to. And if it's not provided, it will be created. But there's other groups like the Renzo Boys, who are named after a young man who was shot and killed, and they have organized themselves around him in his honor. And when his honor is dishonored, then it is a war. So the war isn't driven by territory. It's not driven by like the drug economy per se. It's driven by pain. And so when we talk about the importance of healing being a part of prevention and a critical form of intervention, we have to look at it holistically. So the 4-1 for Life program, and again, I'll just cover this briefly. It focuses on conflict de-escalation and mediation, street outreach and community engagement, and hospital response, which I mentioned previously. Since the program, the partnership with Freighter Hospital, basically, again, when survivors are referred to the program, this is some of the demographics. So in program year 1, started in May 6th of 2019, under the leadership of Eric Conley, who was COO at the time and now president, and then also by Dr. Terry DeRone Cassini and Dr. David Milia, who really shepherded this process and this partnership more aggressively than I thought possible. Because we know that hospitals have bureaucracy, government is bureaucracy. But given the fact that they were committed to this, they moved aggressively because their trauma surgeons, their nurses, and their staff, again, who are seeing these patients and sometimes repeat patients coming back, is what can we and what should we be doing beyond successfully repairing people physically? And so this has been their investment in the 4-1 for Life program that has served over 800 gunshot victims in the city since May of 2019 alone. So the last thing I want to mention is at the end of 2020, which was the first historic spike in gun violence in the city, there was a call to action. And that call to action was, we should be addressing gun violence with the same level of coordination, vigor, and focus that we did COVID-19. And so having worked in the health department, I know firsthand that at the beginning of the pandemic, there were calls every day with at least between the city and county, emergency management, there had to be at least 75 to 100 people on these calls that started every day. Then as time went on, became weekly, monthly, and then ultimately disbanded. And so we said, imagine if we took that same kind of approach to gun violence. And so VR Fast was started as an attempt at that approach. And so this has been going on now for 2 years. And the mission is to coordinate a unified multi-sector public health and public safety response to reduce the impact of firearm violence and homicides on individuals, families, and communities. And it advances Goal 6 in the Blueprint for Peace. And so, again, you have people across all of these sectors, whether it's city, county, state, law enforcement, community-based prevention programs, who are talking about, and not just talking, but also planning what is the public health-driven response going to be. And there's firewalls respected in terms of what law enforcement has to do and the information that they have to move on, and the information and work that programs like Forum for Life have to do, which have to be completely separate from law enforcement because they don't have backup, they don't have 2,000 personnel, they have their credibility, they have their relationships, and they have the trust that they need to do the work that they need to do. And ultimately, at the end of the day, the focus from a public health perspective is how do we keep someone from having to go to jail, to a graveyard, or an emergency room? And we have to do both. And so anyone, whoever tries to convince anyone in this room or make the argument that enforcement is the only thing that we need to do, if that is the only thing that we needed to do, we would not have a gun violence problem in this country because we have always funded, we have always researched cops, cages, and courts. What we have not done until this year, which again, I look at as a down payment, is invest in prevention to the degree, the historic degree, that the current administration in DC has done. However, that has to also happen at the state and local level. And so again, there's coordination that's happening that is unprecedented in this city. There's a respecting of lanes and understanding that we have to do this together. And so with that being said, I hope I didn't go too much over. This is my contact information if you want to take a picture of it or reach out to me afterward, but I'm happy to take questions. And there's no question that is off limits.
Question. So as a club and as individuals, we're involved in many facets of education, hunger issues, housing issues, things like that. What are the prevention issues that as individuals we can be involved with on the community level that will make a difference, will have an impact? And how do you see well-meaning individuals being engaged in that process?
Absolutely. So I'm going to address it as and saying what you can do as a private citizen, and then also what you can do in terms of your professional affiliations. So as a private citizen, this isn't just like a vocation for me. So it informs where I shop. And I don't mean like, oh, I don't shop in the neighborhoods that have high rates of violence. I try to shop in the neighborhoods with high rates of violence. It informs how I vote. It informs the volunteering that I do. So those are the things as a private citizen that should inform the decisions that you make. If you're going to donate to an organization or support or mentor a young person, I would say use this type of information to inform what you prioritize in that way. Many of you are part of boards, whether they are philanthropic, so I'm moving now to the profession. So you are either a part of philanthropic boards, corporate boards, etc. I think really, again, following GMF's lead, looking internally and saying, not only where's our physical footprint of our business, who are our workers? Because often we think about our clients or our customers, but also think about your staff. I remember several years ago when I was with OVP meeting with the owners of Domino's Pizza, and they own many Domino's, several in the central city, while many pizza places have moved outside of the city of Milwaukee, and it's very hard to even get delivery service. And they wanted to meet because they were concerned because so many of their employees were being harmed due to domestic violence, where their abusers were coming to work to harm them. And they wanted to know as a company what they could do or should be doing to reduce the likelihood of that. So those are things that professionally, those are conversations that should be happening. And then also, if as a company, you all are making investments in wanting to invest in violence prevention or even mentor or do community service, I know the city just passed an ordinance that allows a certain amount of hours for city staff to be paid to actually do community work. And so again, those are examples of things that I've seen both locally and nationally of how people can get involved.
We're going to take one more question, and then Reggie will stick around after to take other questions. Thank you.
Hi, Reggie. Thank you very much for all the work that you're doing. I'm just curious if there is a particular city in the country or even in the world that sort of has figured it out, so to speak, that we as Milwaukee can learn from. Is there a certain characteristics or criteria that's been missing? Because it just seems that it's the same old story. You know, we don't seem to be moving forward.
I would say internationally, and I believe it was Denmark, if I'm not mistaken, correct me if I'm wrong, where there was a mass shooting and they banned, is Denmark, and the prime minister or president, she banned assault rifles in that country immediately. And there was support for that. I think that there are international examples of urgent policy, life-saving policy. I would say in America and looking at other cities, which I did with OVP and I continue to do at the CIC, there is no perfect city. And even when you look at New York, which had a considerable crime decline, they are also seeing an uptick. And so there are practices and there are levels of investment and there's even local policies that do work and that are having an impact, but there's no city that has like a perfect formula. I think it's a combination of both investment and programming, coordinated approaches like VR Fast, as well as proven policies that I think we all can learn from.